Right now I'm showing you all the muscles of the posterior compartment, but I'm going to isolate now the deep muscles of the posterior compartment, also known as deep extensors of the forearm. Now these are 5 muscles that I'm going to list now: the supinator, the abductor pollicis longus, the extensor pollicis brevis, the extensor pollicis longus, and the extensor indicis. Now, another easy thing that we need to remember here is that all these muscles will be innervated by this nerve that you see here highlighted in green. And if you remember well, yes, this is the radial nerve. And knowing that, we're going to move on to the very first one on the list here that you see highlighted in green. This is known as the supinator muscle. And the supinator is a broad muscle in the posterior compartment of the forearm that is curved around the upper third of the radius, as you can clearly see here on this image. Now, in terms of origin points, it has a complex origin tendon arising from 4 places. One is the lateral epicondyle of the humerus. Another one will be the radial collateral ligament, the annular ligament of the radius, and another origin point will be the supinator crest of the ulna, as you can see here on the image. Now, the muscle will then be inserting around the radius on the posterior surface of the radius. In terms of functions or actions associated to the supinator, you can see it here in action. And the name says it all. The function of the supinator is to pull the radius, causing then lateral rotation of the radial-ulnar joint. So as you can see here indicated by this arrow, this is what we call then supination. Ready to move on to the next muscle that you see here highlighted in green. This one is the abductor pollicis longus. And this muscle has 3 origin points that you need to remember. One being the posterior side of the radius, the other one being the posterior surface of the ulna, which you can clearly see here. And the other one will be then the interosseous membrane, or a membrane, as the name indicates, interosseous, meaning between bones, a membrane which you should find between the radius and the ulna. And this muscle will then be originating from the interosseous membrane. The abductor pollicis longus will go all the way to then insert at the base of the metacarpal bone of the thumb, as you can see here. Often the insertion tendon splits into 2 and additionally attaches to the trapezium, which you can also see here, the trapezium bone. Now, when we talk about different functions or actions associated to the abductor pollicis longus, and the insertion points told us a lot. The abductor pollicis longus will be pulling the thumb forward at the saddle joint, or the joint between the trapezium and the first metacarpal bone. This movement is what we would call then abduction, which leads to also a lateral movement of the radius at the wrist joint at the same time, which is called then radial abduction. And you can see these movements indicated by this arrow here. We're now ready to move on to the next slide, the next muscle here. This one is going to be then the extensor pollicis brevis. And this one is found also on the dorsal side of the forearm, as you would expect. And in terms of origin points, it begins more distally at the posterior side of the radius, which you can still see here from this image. And also that membrane that we talked about before that you see now here on this image, this is the interosseous membrane, and you can see how it originates from the interosseous membrane of the forearm. Now the extensor pollicis brevis muscle is going to then insert at the base of the proximal phalanx of the thumb, as you can see here. Based on the name, you could guess a bit on the functions or actions associated to the extensor pollicis brevis. The extensor pollicis brevis will be causing extension of the thumb in the saddle and metacarpal phalangeal joints. And these joints can be also seen here. So this is the saddle joint between the trapezium bone and the first metacarpal, and the metacarpal phalangeal joint of the thumb, which is found right about here, between the metacarpal bone and the proximal phalanx of the thumb. And you can see this movement indicated here by this arrow. This also leads to radial abduction of the wrist. Moving on to the next muscle on our list, this one that you see here highlighted, it is the extensor pollicis longus. And this muscle arises medially at the posterior side of the ulna, as you can clearly see here on this image. And another origin point will be the membrane that I talked about, the interosseous membrane, which you can also see here on this image, which can serve as well as an origin point for the extensor pollicis longus. When it comes to the insertion point for this muscle, it will be inserting at the base of the distal phalanx of the thumb, as you can see here. And there at the insertion point, it will form the dorsal aponeurosis, covering the thumb medially, laterally, and also dorsally. And this sheet-like tendinous expansion will serve mainly as an insertion point for muscles and also some of the ligaments. When it comes to the functions associated to the extensor pollicis longus, this muscle can cause extension of the thumb in the distal interphalangeal joint seen here indicated by this arrow, and contraction of this muscle can also cause dorsal extension of the hand. The next muscle that we're going to be covering is seen now highlighted in green. This is known as the extensor indicis. And in terms of origin point, the muscle is going to then originate from the posterior side of the ulna, as you can clearly see here on this image. And also the interosseous membrane will be serving as a origin point for the extensor indices. Now the muscle goes and then inserts distally at the dorsal aponeurosis of your index finger, as you can see here. Now in terms of functions or actions associated to the extensor indices, the name says it all, extensor of the index finger. So the extensor indices pulls the index finger while causing then extension at the metacarpal phalangeal joint, the proximal interphalangeal and distal interphalangeal joints, as you can see here represented by this arrow. And keep in mind that the metacarpal phalangeal joint is found here, just between the metacarpal bone of the index finger and also the proximal phalanx of the index finger. The proximal interphalangeal joint is found right about here between the proximal phalanx of the index finger and also the middle phalanx of the index finger. And the distal interphalangeal joint is found just right here between the middle phalanx of the index finger and the distal phalanx of the index finger. So when this muscle contracts, it's going to be able to extend all of these joints. Contraction of this muscle can also lead to extension of the hand. Now that we covered all the muscles, I would like to talk a little bit about the different clinical aspects, or one clinical aspect related to the deep muscles of the posterior forearm. Now, the narrow course of the deep branch of the radial nerve between the two layers of the supinator muscle will carry a high risk of entrapment. And this is a condition referred to as the supinator syndrome. And since the deep branch of the radial nerve supplies the extensors of the forearm, the affected patients will then additionally exhibit what is known to be as weakened ability to extend the hand and also their fingers. Now, a bit of a fun fact here on this image, that if you extend your thumb, as you see on the image, you see this triangular depression just below the tendons. This is what we call anatomical snuff box or radial fossa. The anatomical snuff box is going to be framed by the radius, as well as both tendons of the extensor pollicis longus dorsally and the extensor pollicis brevis on the palmar side. There are two clinical significance related to this structure that I would like to add here on this tutorial. If you palpate the anatomical snuff box, you can feel the pulse of an important artery, the radial artery, because it runs in this region. Also, the anatomical snuff box is used to palpate or feel the scaphoid bone as a quick way for diagnosing a potential scaphoid bone fracture.